But I find that it's helped me move through periods of sort of exposure to colds, maybe flus, but certainly colds, much faster. And actually, there are data to support that it can prevent contracting the flu virus.
Well, not necessarily contracting it, but certainly having the symptoms of it. So this is like the best study you could ever imagine, right? So this is a multi-centered, double-blinded, placebo-controlled trial, right? So you're eliminating a lot of the confounders. And what they did was in a winter season, so I think it was over 3 to 6 months, people were taking 600 milligrams of NAC twice a day. And what they did was they looked to see how many people got infected and what their symptoms were. And while it did not reduce the number of infections from influenza, there was a significant reduction in the symptoms of influenza. So infections, no, it doesn't reduce, but symptoms dramatically. And which symptoms specifically? It's the most annoying symptoms. So the one that dropped the most was the runny nose and the sore throat. That was what it was best at reducing. There's been some question about NAC because it's so good for cells, right? Because it replenishes. There are some studies in vitro in cells that are designed to be models for cancer, that NAC can actually cause the propensity for some of these cells to grow and expand. I think that probably needs to be taken with a little bit of grain of salt because these were in models that are designed for cancer cells to grow. So the same thing would happen if you were to give nutrition to cancer cells on a petri dish, right? That doesn't necessarily mean that nutrition causes cancer.
Right. Yeah, you raise a really important point around this. I mean, the joke that was told to me years ago is, a drug or a compound is a substance that when injected into an animal creates a scientific paper, meaning it's very easy to see things change when you when you do a dose response curve of just about anything.
Right.
And some people might say, well, thank goodness, are any compounds doing anything that's real, or is it all placebo? I think there are real effects of compounds. The context is really important.
Yeah.
Do you take NAC continuously, given your job, or do you increase your dosage when you're coming into contact with flu patients?
I do exactly as this paper was doing. In a winter season, when I know that things are going to be elevated and high, and I'm going to be seeing a lot of influenza patients, I do take 600 milligrams twice a day. But I try not to do it for more than 3 months. I don't know the long-term effects, but I think 3 months is probably good enough.
Yeah, I know people take it continuously. I've never taken it continuously.